Hello, sir. How are you?
I'm good.
Please introduce yourself.
Yeah, so I'm Dr. Ashwin Tamhankar. I'm a dedicated urological cancer surgeon and robotic surgeon at Dinanath Mangeshkar Hospital, Pune and Apollo Hospitals, Mumbai.
So, sir, why did you opt for this specialization? Also, tell us about your professional journey till date.
Right. So, urological cancer cancer or uro-oncology is a subspecialization after urology training. When we get into the urology core training, we have 6-7 ramifications out of it, out of which cancers is one of the important domains. The incidence of urological cancers is quite rising, and it is a very vast field in itself. So when I completed my urology training, I thought that I should embark upon a journey of uro-oncology training more, and ventured into 3 robotic fellowships, including one in Tata Memorial, one in Delhi, and one in UK. And then I decided that I will try and restrict myself into uro cancers dedicatedly, and that's the niche area of expertise where I involve myself into dedicated uro cancers and robotic surgery services.
Great. So, sir, how many patients out of 10 comes to you of prostate, stone cancer and others?
Yeah, so predominantly, like I said, because I look into only cancers, I generally do not have stone patients coming to me. It's all predominantly prostate cancer, kidney cancer, bladder cancer, testicular cancer, and penile cancer which comes across, out of which the most common one is obviously prostate cancer. If I can say the proportion of the patients, probably about 60% patients to 70% patients will be prostate cancer patients.
Okay. What are the key treatments you oversee currently?
Like I said, dedicated uro cancer services would include all kinds of surgeries, including open surgeries, laparoscopic surgeries, or robotic surgeries of that particular field, especially prostate cancer. Robotic surgery, though it is not a new thing in India, but it's evolving. The role of robotic surgery is translating across the patient masses at this point of time. So that's the overall spectrum of disease which I treat, and I overall look as the entire horizon.
Okay. Has telemedicine helped in delivering faster medical advices to patients from across the world?
Probably yes, I would say. Reason being, it's predominantly also after COVID, because online virtual consultations and stuff is increasing after COVID. So these days we get a lot of inquiries for virtual consultations. So plus currently in this particular era of digitalization, I think majority of the patients are well read. They are very inquisitive about knowing about their illness themselves. So they read through the literature. So telemedicine is one of the important domains out of this entire basket. Yes.
Okay, great. How would you rate the advancements in medical science in India when compared to the West?
Yeah, so talking about my particular field, I think we are at par with the Western countries. Whatever the robotic surgeries or whatever the high-end machineries or high-end instrumentations which we have in the West, we have it equally similar on the in our spectrum in India. Apart from few important genetic testings or certain high-end testings which are currently at this point of time we are lacking in India, majority of the management-related spectrum is already available, and we do the equally good job as compared to the West.
Okay. So last question, how do you see the future of Indian healthcare sector?
Right. So Indian healthcare sector, it's evolving. Again, early times, it used to be a practice which used to come to a private practitioner or a single standalone person. The times are changing. The overall process of medical, the patients, like I said, inquisitiveness, patients understanding about the illness, they're all completely changing. So healthcare is an evolving field throughout, and that will keep evolving for another decade as well. It's getting better and better. Most importantly, as a clinician, I would say the transparency is very important. We need to be keeping patient first as the primary approach for our patients, and giving the practice in this current point of time in 2023 is certainly not going to be a 2 minutes of quick discussion with the patient and wrapping up the discussion. It takes good amount of time which you need to be investing as a clinician with the patient for explaining all the modalities of treatments available to that particular patient, and then based on the discussion which you have back and forth, we will take the joint discussion. So it's called as informed decision making. So that's an era of informed or shared decision making which we need to be understanding as a clinician.
Okay, great. It was nice talking to you. Thank you so much for sharing your experience and thoughts with all of us. It was great having you here.
Thank you.